Hello?
Hi, Mary. This is Dr. Fine.
Hello, Dr. Fine.
I'm reaching out because your smartwatch alerted us of a possible irregular heartbeat.
When it comes to virtual care, InterSystems gives healthcare providers a complete picture of their patients' health through data they can trust and seamless interoperability.
I'm all right today, so...
Are you experiencing any pain in your chest or arms?
No, nothing like that, no.
It doesn't sound serious.
Oh, good. That's a relief.
But I would like to run some tests just to be sure. It looks like we have an opening Friday morning. Are you available then?
Oh, yes, good. Yes, I'm free then.
As the power behind over 1 billion patient records, InterSystems brings together doctors and patients, no matter where they are. InterSystems, the power behind critical data.
Good morning, good afternoon, good evening, everyone. I'm glad to have you join me here today. My name is Don Woodlock. I lead the healthcare business for InterSystems, and I'm here to tell you about our vision for healthcare, which we call healthy data. So I will describe what I mean by that, describe some of the things that we're doing about it for you today, and some of the new exciting announcements we have for the future. So by way of introduction, I have been in the healthcare software business for the last 30 years. I've worked at 3 different companies and have enjoyed several years here at InterSystems. I built software for payers and health systems and regional health authorities, life science companies, software developers, all in the health space. So I really love the health data topic, and I'm excited that you've come to share in this with me. I'd be happy to hear from you after this session if you're interested in hearing more. So let's talk about 2020. We've spent the whole year, or most of the year, fighting this global pandemic. And I have a question for you about this. When you think of fighting COVID-19, what do you think has been the most powerful tool in our toolbox around this fight? So the ventilator would be a good choice. You remember the mad scramble at the beginning of the year to find and procure and distribute enough ventilators for all the ICU beds and all the patients that needed that. Personal protective equipment might be a good choice. You remember also the scramble to get enough PPE for all of our frontline workers to confidently take care of our patients. Or even some of the treatments this year, like remdesivir, around lowering our case fatality rate for the disease. Well, these are really good choices, but I think the #1 tool that we've had this year to fight this pandemic has really been data. Data about new cases, the new case rate, where they're occurring, when the peak is going to be, how high the peak's going to be. Are we in wave 2 or wave 3? How is the testing going? Where are we doing enough? Where are we not doing enough? Where are the positive test rates? When should we close our economies? When should we open our economies? When should we send our kids to school? Data has really been the centerpiece of knowing how to fight this pandemic around the world. And the healthier data, the better. The more accurate it is, the more understandable it is, the more useful it is, that becomes a real powerful tool. Now, I like this expression, data is the new eyes. And I think when you think of the fight against the pandemic, it's really true. Like if you wanted to know what's going on in your front yard, you can look out the window and use the old-fashioned eyes to do that. But if you really need to understand the world or your community or how things are going in your country or your state or your region, you really need data. Data is the only way to see what's going on. And the healthier, the better. So when we think about health data, we think about healthy data, really. And the object of healthy data, the real goal, is to have healthier patients and more empowered clinicians. And the way we define healthy data is that it's accessible, it's usable, and it's ready for action. So by accessible, I mean it's not stuck in siloed systems. It's available, it's brought out of those systems, it's put into the places that it needs to be. It's usable, so it's understandable, it's defined, it's trustworthy, it's secure, it's something that you feel comfortable using. And then it's ready for action. So data at rest is not that useful, but data put in the hands of a physician making a patient care decision, put in the hands of researchers, put into machine learning algorithms, put into public health officials. Data that's really brought out of the silos and put into action is healthy data to us. So before I like to talk about us, I always like to talk about you and what you need as our customers. So from a healthy data point of view, we think of your needs as these four. So first is capturing, managing, using information at the source. So make sure that the data is captured in a seamless manner without turning everybody into a data entry clerk, that it's used at that point of capture, which is usually the point of care. The second is that it's brought together. So you might have dozens, if not hundreds, of different systems throughout your enterprise. So bringing that data together and unifying it. After all, a patient health journey is not transactional. It's a lifelong journey. So bringing that together to really understand the patient life cycle or your community is incredibly important. The third is to optimize your workflow, to help your organization run smoothly, and for all the folks inside your organization to have the right tools to make the right decisions. And then lastly, you need to innovate. All of your communities are different. All of your organizations have different strategies, have different goals, and you need the tools to really innovate based on that data to meet your particular needs. So aligned with those four goals, we organize our work along those four. So the first is really comprehensive health information systems. That's what TrackCare is all about. From running a lab to lots of labs, to a hospital, to lots of hospitals and clinics, to whole countries of public health, public hospital systems. TrackCare is all about sort of managing that workflow and managing the information in the patient care process. HealthShare is really around unifying that data across the continuum. So really aggregating, normalizing, deduplicating, unifying that so you have cohesive information that you can power your caregivers and you can see your population very clearly. The third is around analytics and solution components, and I'll talk about a few examples of these in a few minutes, but really helping you solve the problems that you have, taking our technology and tools together and making them solution-oriented for you. And last is development technology. So we're all about innovation. We use Iris for Health to build TrackCare and to build HealthShare, and we want to empower you to use our development technologies to build the kind of solutions that you need for your users, your patients, and your community. So now I'll dive into what we've been up to this year, but I would say it has two broad themes. The first theme, of course, is COVID. So COVID has consumed all of you this year. It's consumed us this year. And we feel we've been responsive to your needs. We've been amazed at your responsiveness. You folks have been the front line. You folks have been fighting the battle. And we're honored to be partners with you and help in any way we can. So we've done 6 major releases through the course of the year, sort of more than ever at this point. With TrackCare and HealthShare, new releases of questionnaires, of icons, of dashboards, of viewer, of tests, of observation items, all the things you really needed to fight COVID quickly in your communities and be responsive to your patients. In fact, we were looking up a little bit of history for this presentation, and our first release was January 30th, actually. We released a patient assessment questionnaire based on the WHO survey for the novel coronavirus. So we released that back in January, got it out in February and March to 28 different countries to really help you from the beginning manage the pandemic. And we have customers in basically all the hot spots, in New York City, in Italy, in Wuhan, in South Africa, in Latin America, in Paris, in England, in the Middle East. We've had customers throughout the world fighting the pandemic, and we've been really happy to be there to support you. The other theme for this year is FHIR, basically. We are so enthusiastic about the FHIR standard because it really is the best approach to get the data out of the systems that they're in and make it usable for you to build mobile apps, to empower researchers, to empower clinicians, to really get that data out of where it's been living and difficult to get out of. And so we've done a lot of things on Fire this year. I'll talk about a few in a moment, but we have a Fire stack. We upgraded it to R4. We improved performance, scalability. Of course, our HealthShare and TrackCare systems, they speak Fire, so you can basically leverage the data out of those two systems with the Fire API. And we also have technologies to basically Fireize your legacy system, so you can also make that data available. So this was a very big theme. Now, Fire doesn't solve every problem in terms of interoperability. Regulations are also helpful. Industry collaboration is also helpful. But we've had a lot of advances on both of those in the past year as well. So those are the two themes we had, really, COVID and Fire. And now what I'd like to bring you through is 6 different announcements we have this week that I wanted to share with you. So the first is an announcement that Apple made a couple weeks back, and we were privileged to be in their press release about the launch of Apple Health in the UK. So we've been working for the past year closely with Apple and secretively with Apple, as it turns out, to get TrackCare integrated into the Apple Health environment. And we're pleased to have done that, and we're pleased to announce that it's now available for our customers in the UK. We've been testing with a customer, Lothian, in Scotland. They hope to go live in the coming weeks with their patients. And as we passed the Apple testing, it actually was with our Fire stack, which is part of HealthShare and TrackCare. So it's available for both product lines, and it's available wherever Apple Health works, which is in the US and now in the UK and in Canada. So you can take advantage of this if you want to help get patient information to your patients that use the Apple devices. So that was pretty exciting. Now, second announcement really it's related to COVID, but there's been a huge rise of virtual health through the course of this year. And so we've updated TrackCare to work with virtual health technologies, as well as some late next-generation collaboration tools. So on the telehealth front, we basically have done integration with Skype and Attend Anywhere and Google Meet and Teams and WeChat, basically all the major video chatting platforms around the world. And essentially the way it works is when you register a patient in TrackCare, you also put in the patient's Skype ID, let's say. So it's like a phone number or an address. It's basically a way to reach the patient. When you book an appointment in TrackCare, we integrated with these tools so that they can generate a meeting URL that gets sent to the patient and then put in the TrackCare schedule. And then when the virtual visit starts, you just click on the link and the patient clicks on the link. It's integrated right within the TrackCare environment, and the basically virtual visit can start. So it's really integrated well into TrackCare. In fact, one of our customers in Latin America, they went live first with TrackCare for all their virtual visits a few weeks ago. So this is a really nice advancement to TrackCare. The second is we integrated with Microsoft Teams. We're seeing a lot of customers that have replaced their communications infrastructure, so like the nurse call systems, those kinds of things, with Microsoft Teams. And we integrated Track deeply into the Microsoft Teams channel functionality. So I'll just describe this with an example. So let's say you have a patient in the ED that needs a cardiology consult. So anywhere that you can send a message or an alert from TrackCare, we can drop that message into Teams. So it can drop into, let's say, the cardiology department's channel. The cardiology department will see that message, will see it urgently, and in the message it'll have a link right into TrackCare where they can click on that and see the whole patient chart. So basically, Track is integrated right into this communication infrastructure if you have solidified on Teams as an example. And the third example is a really great implementation of Microsoft Teams that our customer Northwell Health has done. And essentially it's a chatbot named Nora. And the way this works is physicians are interacting with Nora as if they're interacting with another person on Microsoft Teams. So they can send Nora a message like Woodlock Labs, and it'll look up the patient Woodlock, grab my last labs, and show them to the physician right within Teams. Could be on your phone, could be on the desktop, wherever you're running Teams. You can say, remind me when Woodlock's x-rays come back. And then in an hour or two, when my x-rays come back, a little message will come back. Nora will update the physician with a little link to see the images and that kind of thing. And then there's a variety of cards that they built, COVID cards, other risk scoring cards that basically show information about the patient right within Teams. So it's a really elegant user experience for physicians interacting with the clinical data through this chatbot approach with Nuestra. And there's a bunch of sessions through the course of this week and next, so you can see more on that front. So the third announcement is a new offering that we're building called the Iris Fire Accelerator service. And basically what this is, it's a fully managed fire service, including a repository to store the data. So it has all the APIs there, so create, read, update, delete, search API functionality. We manage it for you in a cloud-hosted environment. And we have an environment that has a starter kit for developers, has a developer portal, so you can kind of set it up and use the environment in a nice, easy-to-use, elegant user experience. So we're planning to launch this at the beginning of next year, and we're building it now. The fourth thing I wanted to talk about is a new offering for HealthShare called the HealthShare CMS Solution Pack. So the Centers of Medicare and Medicaid Services came out with a series of regulations that basically require payers and providers to expose their patient and members' data to them via FHIR. So you as a patient basically can authorize apps or software or websites or whatever to get access to your data to help you manage your chronic conditions or your health expenses or what have you. So what's tough about this particular one is that the deadlines are looming. So they start January 1 of 2021. And so we've met a lot of customers that are very interested in a targeted solution to this particular problem, solve this, and then we can expand the use cases from there. So that's why we built the solution pack. It's basically a combination of HealthShare, Iris for Health Technologies, implementation, pricing, hosting, all the tools that you need to get compliant with these regulations in a fast and easy manner. So that's what the CMS Solution Pack is all about. So fifth, we added some new COVID dashboards to our HealthShare Health Insight application. So these will give you trends around symptoms, around tests, around zip codes, around risk factors associated with COVID. This is one of the displays. It's a heat map display based on those factors, risk factors, by zip code, graphing it in a geography, in this case, the state of New York. So this is available to you as a template. You can take it and modify it from for your region or for your needs. And you can also modify it for other different patient populations. So if you want to look at your diabetics or your high-risk pregnancies or your frail elderly or what have you, you can customize this for other kinds of populations where you might want to see trends and different geography displays. And then the last announcement I wanted to talk about was HealthShare Managed Connections. So this offering I spoke about a year ago, and what it was at that time is we started with sponsored connections. So if you had, 5 to 10 different health systems that you wanted to connect to in your community, you could hire us to do that. We'd build the connections, we'd manage those connections, we'd monitor them 24/7, we would make sure the VPNs are staying up, we would deal with EMR upgrades, we would basically have those things working for you at all times. We would take that burden off of you. So we do that. Plus, since last year, we've added the Commonwealth and Carry Quality networks to our hub. And basically what this allows you to do is get access to these 2 national networks, which bring tens of millions of patient records to you with just a single connection. So Commonwealth, in addition to other EMR vendors, basically has all the Cerner sites. And Carry Quality basically has all the Epic sites, in addition to a few other vendors. So between these two, you basically have tens of thousands of organizations that you're connected to and over 100 million patient records that would be available, all with just this one connection. So pretty big advancement in terms of making it easy for you to present a complete patient record to your caregivers. So those were basically the 6 things that I wanted to walk you through. Now I know that was a lot, but we've been very, very busy this year. So there's a lot of opportunities this week and next week for you to learn more. I'll just highlight a couple of the keynotes. So we have Michael Marchant from UC Davis. He'll be speaking about healthy data as well and all the great work he's done there. We had Dr. Paul Tibbetts from the Veterans Administration a little bit earlier in the day. Hopefully you got a chance to see him talk about how he's using HealthShare and InterSystems Iris for Health to bring data together for the veterans. So those are really two good sessions. And then tomorrow we have two sessions on our roadmaps. First is Dimitri Fain. He leads our product management team for TrackCare. So he's going to bring a lot of demos and a lot of presentations on all the interesting things we're doing on the TrackCare front. And Dr. Jonathan Teich leads our product management for HealthShare. He'll be doing the same thing for HealthShare. A lot of good demos, a lot of presentations. Should be really, really exciting. And then a lot of great content also through this week and next week that I hope you'll get a lot from. So I wanted to leave you with one parting thought about healthy data before I close. I love being out and about and running into a guitar or a piano that's free for me to play. But there's always something I do first whenever I pick up an instrument. And every musician does the same thing. You check to make sure the instrument is in tune. You have to do that because a badly out-of-tune instrument, there's nothing you can do with it. You can be a great player, which I'm not, or a great songwriter. You can be a great professional musician, but there's nothing you can really do with a badly out-of-tune instrument. There's really no workaround for that. So the first thing you have to do is tune it. And that's the way I think about health data. So if you think of health data, it's basically badly out of tune. It's stuck in silos. It's difficult to get out. It's difficult to put it in the hands of the people that need it. So step one is to make your data healthy. And with healthy data, you can really put it into workflows. You can pull it out of the silos. You can clean it up. You can unify it. And you can empower your physicians and researchers and caregivers and machine learning folks and population health folks with the great data that they need. So if you want to empower your organization to play that next great song, you really have to make your data healthy first.